So, bienvenidos a todos. Welcome, everyone. My name is Julie Oviero, and I'm a project manager here at the Task Force for Global Health. I work specifically with the Public Health Informatics Institute, and I'd like to welcome you all to the fifth discussion in a series of panels called The Faces of Global Health, which is hosted by the Task Force for Global Health and through CODE. CODE stands for Council of Opportunity, Diversity, and Equity. And this group works to promote those initiatives. CODE's mission is to become a role model in our local and global communities by being actively engaged in equity efforts in those communities and to help achieve equity in our organization and community through education, action, and public health. So let me tell you a little bit more about the Task Force for Global Health. For those who may not be familiar with the work that we do, the Task Force for Global Health is a nonprofit organization that works in over 150 countries, helping to advance health equity so that all people can achieve their full potential. Let's speak more about Latinx and Hispanic Heritage Month. Latinx and Hispanic Heritage Month is celebration of the history and culture of Latinx and Hispanic communities. It commemorates how our communities have influenced and contributed to the American society at large. Now let's go through some of the terminology that you may have heard before. What is the meaning of Hispanic and Latinx? Hispanic refers to people from Spain and other Spanish-speaking countries. It includes countries like Mexico. It includes countries like Brazil, and the term is mostly used in the United States and has been largely criticized for highlighting Spain, which colonized most of Latin America. On the other hand, Latino, Latina, Latinx refers to those from Latin America, meaning it includes Brazil, but the term de-emphasizes the connection to Spain. It's a term that attempts to group several distinct cultures into one. And although Hispanics and Latinx communities are grouped together, we're still made up of a community of people who share common languages, common culture, and we are also very diverse. And it's important to note that we span across several continents. We'd be remiss if we did not mention our task force colleagues, Dionisio Herrera and Mariana Monsieur. They're no longer with us, but I have no doubt that they would have been sitting on this panel with us if they were still here. And I personally learned so much from both of them and remember them fondly. A little bit about them: Dionisio, who was affectionately referred to as Dio, served as the director of the TEFINET program at Task Force for Global Health. He was a huge presence and advocate for marginalized communities. His very presence came with a booming voice, and he had the ability to connect with so many people and also bring people together. Mariana also worked with TEFINET, and she dedicated countless hours to supporting country-based leaders and to promote their success. She was a fierce advocate for her team and for the TEFINET program. We recognize them today because they gave their very best, always, and their contributions made a big difference to our community, and they had a great impact. Now, here's a fun and engaging part of our panel where we take time for each of you to share a little bit about yourself. In the chat, introduce yourself, state your name, where you're from, and share with us a person from the Latinx Hispanic community working in global health who has served as a role model for you. And now I'll introduce our panelists. We have Jonathan Hernandez, who has a research background and dual Bachelor of Arts degrees in International Affairs and Spanish from the University of Georgia. Jonathan previously dedicated his talent in the government agencies and law firms. His former job at the U.S. State of Georgia Secretary of the Senate's office allowed him to experience Georgia's session firsthand and to dive into a distinct realm of work. His past experiences within law firms allowed him to use his fluent Spanish translation and interpretation skills to help Spanish-speaking clients who sought legal advice. Jonathan will now work as a program assistant for TEFINET, where he hopes to use his skill and talent to help with projects centered in Latin America. In his free time, Jonathan enjoys working out, listening to music, and reading philosophy. Welcome, Jonathan. Dr. Angela Hilmers serves as Director of Strategic and Technical Initiatives for TEFINET. Prior to joining TEFINET as a permanent team member, she was a consultant medical epidemiologist for TEFINET for the implementation of the Frontline Field Epidemiology Training Program, FETP, in the Americas and Caribbean regions. Prior to this, she was a Global Health Fellow at the CDC and provided technical support to FETPs in West Africa. Dr. Hilmers has significant experience in scientific planning and qualitative and quantitative research studies related to non-communicable diseases. She received her MPH from Johns Hopkins and a diploma in tropical medicine from Baylor College of Medicine, National School of Tropical Medicine. Welcome, Dr. Hilmers. Daniela O'Connell currently serves as the Deputy Director of the Task Force's Public Health Informatics Institute. She co-leads the strategic direction and execution of vision and mission for PHII. She came to PHII after serving 4 years as a program associate for another task force program, TEFINET. And at TEFINET, Daniela managed multi-million-dollar CDC cooperative agreements and a portfolio of over 15 projects that focused on health systems, capacity building, and strengthening for the FET programs in Latin America and the Caribbean. Daniela earned her Master's of Public Health from Georgia State University and holds a bachelor's in psychology from Armstrong State University. She was born and raised in Barranquilla, Colombia. And we welcome Daniela. Welcome, panel. Thank you so much for joining us today. I'd like to just go through a couple of questions and like to hear your response and learn more about your experiences in public health. People often come to careers in public health in many different ways and for many different reasons. How and when did you become aware of public health and what made you pursue it? Daniela?
Thank you, Julie. Sure, I'll get us kicked off here. First of all, thank you for inviting me to be part of this panel. I guess I'll tell you a little bit of my story and how I got to public health. So I came to the United States 20 years ago on a Rotary 1-year ambassadorial scholarship. So this was almost like a gap year for me. I came, I was gonna do the 1-year scholarship and serve as an ambassador to Colombia. And then I was gonna go back to Colombia and pursue a degree in either medicine, become a dentist like my own mother, or become a professional psychologist. Well, got here, I kind of loved it and was able to get some academic scholarships that allowed me to stay and complete my bachelor's degree. And when I was in my junior year of college, I took a biomedical ethics class that brought us on a field trip to the CDC Communication Center and Museum. And it was there that I had my aha moment where I was like, wow, this is exactly what I want to do next, or this is exactly where my career should be in. And so when I discovered public health, what made me pursue it was I realized that my calling was not really in the one-on-one with people as a medical doctor or as a dentist, but rather pursuing, population health where I could potentially impact the lives of millions of people. And I was also very intrigued by the notion of disease prevention and just health promotion. So.
Thank you so much for sharing that, Daniela. Angela, the same question.
Thank you, Julie. And thank you, Daniela, for sharing your experience. This is my first time hearing that. That was very, very interesting to know how you came to public health. And thank you to everybody who is attending this webinar. I know we kicked off with this kind of nice song. We are not offering dancing classes, just to make sure. For me, I'm a physician by training. And what happened was, I was, as Daniela is saying, we do a one-on-one type of service with our patients, but I was doing medical mission trips just to make sure that I address some of the needs, in areas, vulnerable populations that didn't have access to medical care. So that's my first step, I guess, towards global health. And I was doing that during my breaks and vacation time. I visited a number of countries in South America, Southeast Asia, never been to Africa. And then when I came to the US for my postgrad education to do my master's in observership at Baylor College of Medicine as a physician then, I started to think whether global health can be a career rather than just a hobby. And that is what brought me to first doing my master's in public health at Hopkins, has a very large international health department. And next to CDC to do a fellowship, which brought me to West Africa, which had never been in the continent before. It's a great experience, and to FEDP, and from there, to TEFINET. So it's been a very interesting, success of events, I would say. But I'm very glad that happened, and I discovered that I could do global health as a profession for a living. At that time, I was paying for my trips, and now, just to be honest, I get paid to travel, which is a great thing to have. But yeah, that was, I think that, I don't know for Danielle, but for myself, the purpose was about service, service to others, how we can help people either through, medical care or prevention or treatment, it doesn't matter, but it's how we can help. And I'm very glad that I chose a profession that enables me to do that.
Angela, thank you so much for sharing your personal story. Jonathan, I'd like to ask you the same question.
Good afternoon, everyone. Thank you for being here. Thank you for listening to us. Thank you, Angela and Daniela, for opening up the discussion. So for me, it's not as extensive. I'm still not, I'm still a young one. So it's like in the field, I'm not talking about age. I'm not trying to say that anyone, older than me, but in the field, I'm still a little young. So I'm still soaking my feet in. And but how I came about coming into public health was through my sister. My sister has always been like my great inspiration. Everything she did, I wanted to follow in her footsteps, and she was the first one to go to college. So of course, when I found myself a little lost after graduation, I went back to her for my next step. And she graduated with a master's from Rollins, so Emory. And after helping her out in one of the programs she was doing while she was trying to get her master's degree, which was basically like the implementation of diabetes risk reduction in Hispanic males through training programs. I basically thought that they may be a good fit for me because at the time I was working for attorneys, and attorneys are very interesting because I'm not gonna go too in depth. Basically, attorneys are like trying to help individuals, but working behind the scenes, you get to see that attorneys help people, but not really because they want to. It's more like a monetary situation, and so I felt kind of dirty working for something like that. And so then I thought, well, how can I help out in a way that makes me feel good? And so then that's why I decided to join public health to, maybe do something that like my sister was doing, and not only give back to the community, but also give back to like a group of individuals that needs the help. Or a lot of the times I feel like in Latin American communities, there is that problem where sometimes we don't know how to come across to certain populations because there is that disconnect. And so I thought that maybe me growing up in America and being Mexican, from Mexican descent, so being Mexican American, I could probably fuse my two understandings of the Mexican population and the American population, and hopefully come across to people in a way that is more, um, I guess the term would be in a more comprehensible way, so that there's like not a disconnect as much as there probably would be if someone who wasn't born in the same population um, were to explain something to someone. I feel like there's a lot of mistrust. So I think that mistrust and that passion to do something that made me feel good about myself is what got me into public health. So yeah, thank you.
No, thank you so much for sharing, Jonathan. I think what the three of you guys show is that, despite different backgrounds and despite different experience levels, you can still interact within the public health environment and flourish there. You can, epidemiologist or biostatistician, all of those serve to make public health robust, and all of it serves to help the communities that we work with. So let me move on to our next question. How does having a Hispanic Latinx background benefit your work in public health? Angela?
Unmute myself first. I think, well, what happened since I actually arrived in the United States 13 years ago. I started working, I was doing my postgrad education, but also working at Baylor College of Medicine, doing research, and we work with minority groups, a Hispanic community in Houston, Texas. So that was my first interaction, I think, in terms of how our research team was using my language skills to be able to communicate and pass information along to that group. We're trying to do, it was a NCD prevention type of program, and to be able to teach them and to speak with them and pass along all the data we have captured and inform them what we have found. We needed the language skills. I was the only one who spoke Spanish, even though we were living in Houston, which is a little strange. But yes, in our team, that happened. So then I saw the importance of, I'm not saying that we have to speak 2 or 3 languages. I saw the importance of my role within that team at that time. And then when I moved to, CDC to do a fellowship, I wasn't using Portuguese at all, and I thought that was not useful. I said, well, I speak Portuguese, but I haven't used it for anything professionally. To my surprise, that was an important skill to have because I had to work in Portuguese-speaking countries in Africa, which, and then I realized, well, okay, I'm using everything I have, my tool of, abilities, and so I'm using everything to the benefit of other people because we were able to teach people there and reach out to them easily. So that was a good surprise, great to know that I could use everything I had available to help the team to move forward the projects. And then finally to, come into TEFINET. I guess half, even, I don't know, maybe 80% of our staff is bilingual. So I'm not as special anymore. Everybody speaks the language, which is great, but has been very helpful. And I will speak for you, Jonathan. We sometimes rely on our staff to help us with translations or even just quality checks if the material we have translated is correct, and everything to be able to, kind of disseminate those products, even learning products or any communications to everybody in the network. So I see the importance of having this background in addition to being culturally competent, how you communicate, how you understand the culture and the setting and the context sometimes. So that is very, very important. So I see everything as useful. But again, I don't think I'm special here. Everybody in my team has had exposure, has the skills and the knowledge to be able to serve our network well.
Wow. Even with that background, it's very impressive. It sounds like, we've served as translators, role models. We've helped guide community members. And given our backgrounds, the next question is really focused on, how big and expansive the Hispanic Latinx community is. It covers such a large and diverse community, both geographically and culturally. So how would you say that you self-identify, and what do the terms Hispanic and Latinx mean to you? Jonathan, this question's for you.
Boy, this is a very loaded question. So I was very careful about how I was going to respond to this question because I only make up a percentage of the Latinx community, so I can't speak, on behalf of everyone. That would be ignorant of me. But for me, I grew up in a society where Hispanic was like the norm. Hispanic was what was used for me when I had to self-identify, right? It wasn't until I got to college that I understood what the term Latin or Latinx meant to a lot of people. And then I understood that there is a differentiation between Hispanic and Latin. So for me personally, I know who I am. I don't need a label to identify. Yeah, so if someone calls me Hispanic or if someone calls me Latino, Latin, if they say I'm in the Latinx community, I feel no type of way because I know who I am. I don't need anybody to tell me who I am. But with that being said, there are certain people who feel very strongly about this. So I try to respect the fact that there are a lot of people who, this term to them is like, this term represents me. This term is like my main identifier. If you like call me Hispanic and I prefer Latinx, of course it's going to be a problem. So I try to mold myself to those situations, but I personally don't have a preference because, like I said, like I know where I was born, I know where I come from, and I think the importance started to come through when I was young, because even though I didn't know the difference between the two terms, I always knew I was different. I mean, just to give you guys an idea, I went to elementary school. I didn't know a word of English. I was sitting there, a little Hispanic boy, little Latino boy, really confused, not knowing how to ask for water, not knowing how to ask to go to the bathroom, not knowing a single word of English. And I till this day remember this. I was the first one in my class to learn how to read properly, even not knowing a word of English. So to me, since I was little, I knew I was different, but I didn't know why I was different, right? Everyone was just like, well, that boy is weird because he doesn't know how to communicate. Like that was basically like my classmates' understanding of me, because they also were ignorant to the fact that he just speaks Spanish. As little kids, we don't know. We don't know what the difference between English and Spanish is. It's just languages. So they thought I was weird because I couldn't communicate. But I was lucky enough to have teachers that, were patient, because without those teachers, I wouldn't be sitting here right now talking English like I am, So with that being said, and after that, I continued to understand that I was different, but I didn't understand like the importance of it, right? Then I got to a point where I was in middle school and high school, and I knew how to perfectly speak English and perfectly speak Spanish. And my parents would rely on me and my siblings to translate for them. At the beginning, we don't, I just saw this like as a norm. I was just like, well, I'm just doing them a favor. They're my parents, But I did understand that not everyone can do that. That is not something that comes easily to everyone. There are people that sit in a desk in a classroom for hours, and they never learn how to properly say not even a word. So it wasn't until I got to college when I was sitting because I have like 2 degrees. One is in Spanish and the other one is in international affairs. It wasn't until I was sitting in my Spanish classes, and the reason I took Spanish was because I wanted to perfect my Spanish. While I had a basic understanding of the language and I can easily speak it fluently, I didn't understand how to speak it professionally. And there's a huge difference. And so I knew that in order for me to be able to polish myself, I needed that experience. So I got to college, I sat in the classroom. These people in my Spanish class just sat there and they were like, why are you in here? You know? And and I felt good because I was like, I didn't know, that because the classroom wasn't just filled with other colors, and by colors I mean like other races or ethnicities. It was also filled with people that look like me. And those people, they didn't know a word of Spanish. And so then that's when I started to understand, no, I was talking to myself in the mirror, you are like special, you have this gift. And it's because of how you were raised, and because you are Latino or Hispanic, it's so you need to use this gift. And so basically, then it was when the light bulb turned on, and I was just like, okay, no, being Latino to me is everything that I am, right? Every time I meet someone, I always tell them, you can't outdo me in my Spanish. Like you can try, but you can't outdo me. And I say that very humbly. And it's because I know that I had to fight to get to where I am today. Like I'm saying, like when I was 3 years old, I was already on this journey. I didn't know I was on this journey. I didn't know what I was signing up for, but I got here, and then everything started to click. And even now I feel like there's so much more I can do with my ability, but I still haven't found the right place. I'm not saying the Talking Net is not like a good start because I love being here. Please nobody be mad at me. But it's like I'm happy, that the light bulb finally clicked. And I hope for some of you that are listening to this, the light bulb clicks too. You're special. Don't ever doubt that, because being able to speak 2, 3, 4 languages is not a joke. It's like a blessing, and not everyone can do it. So yeah, I hope that answered the question.
Yeah, I think that did answer a question. And it really speaks to highlighting the talents that you have and bringing forth your experiences, and how that, can really provide that connection to others in the community. And, I'm just happy to have you here in the public health realm, because I think you bring a wealth of experience. And I think, your experiences in law and your upbringing really helps to make public health more robust. As we continue talking about being Latinx and Hispanic in public health, I'd like to delve more into professional experiences. So thinking about your individual heritage and identity, how has your professional experience been similar to or different to other members of the community? Angela, I'll turn this one over to you.
Thank you, Julie. I think I will use Jonathan's example in terms of the ability to speak English. And I think that has been, just in comparison, my professional experience versus other Hispanics or Latinos in the US, is the limitation of not being able to speak English that may have hindered their opportunities here. And I have seen that over and over throughout my career as well. Being here in this country for decades, maybe 10 or more years, but still struggling with communication. And I think it takes, as Jonathan is saying, we have to feel empowered in terms of we're able to learn a new language and be acculturated. I would say the word is acculturation, but you kind of try to take into what this country has to offer. The US, for me, when I came here, I was really, I would say not surprised. I was pleasantly surprised in terms of how many opportunities they had here for minorities. That is not something I had experienced back in South America, for example. And the number of people who belong to these minority groups who were able to take advantage of those. And sometimes English was a limitation for the Hispanic community, not being able to speak, and take advantage of those by doing research, going to college, or maybe higher education. So that is something I realized when I came here. I wasn't aware at the beginning, but it became more clear when I started working and helping those small communities at Houston first, and then later on when I came throughout my career meeting other people. So I would say that will be a difference. I'm the first person in my family who has come here to the US, and the only one. I guess my family is pretty happy in Brazil right now. Nobody wants to even visit me besides my two brothers who came here before. So I don't have something to compare similar to what happened maybe with Jonathan and his family. But what I could say is kind of reflecting back in my professional career, how it started. I saw to be able to move ahead as imperative to be able to learn the language. And that's something I did when I came here. That was my first stop in Rice University to do this ESL program, English as a second language. It's an 8-month program, as quick as possible. Well, and I have to, that is to my mom. I think my mom has a gift for languages. And so I think I will have to give credit to her in terms of how quick I was able to learn. But I saw that as an important requirement for me to be able to continue and to reach my goals. So I hope that that same intellectual curiosity is embedded into the Hispanic community, and everybody that is independent of race or ethnicity. It's about to feel, to set a goal and understanding what it takes to get there. And as Jonathan is saying, feeling special enough that you know that you'll get there, and then you may have to face some challenges, and language could be one, and maybe acquire more expertise along the way. And I saw that I was working first in a research setting, but it was a nutrition project. So I went in and did a master's in nutrition because I wanted to say, well, if you increase your competence, you will increase your confidence. And so the competence, the more competent you feel, the more confident you are. And so then when I started pursuing, like thinking about global health as a profession, I thought, well, let's get a master's in public health. Let's go do a fellowship at CDC. Let's do this, let's do that. And so all of those things, I think are, I'm not trying to brag here, but I'm thinking I have seen other colleagues or friends kind of following the same path and not being limited by something such a language or maybe lack of confidence or lack of knowledge. There is a path for everybody. It's just a way of being able to follow that. And you have the right intention, I think. And your intention is to serve people, and you have to acquire certain skills. You just follow that. So I'm very passionate about mentorship. I think it's important. I was doing that when I was in Houston. I think I miss doing that here. But it's important to empower our young professionals and everybody we have here at Task Force for Global Health. I really appreciate a forum like this to share experiences as well, and making sure that, we provide them with the right opportunities, but not only those, but also the right set of skills and maybe the mentorship they need to be able to reach their dreams. This country offers tons of opportunities. I'm very grateful since I came here.
Wow, that's really fantastic. I think maybe we might have to change it to panelists without borders, because the experiences that you guys are sharing, I'm hearing passion, I'm hearing commitment, I'm hearing, just overachievers. One language is not enough, 2 languages is not enough. I think you panelists are showing us how, with your passion, with your commitment and your skills, how you guys can continue to augment yourself and to share that in your professions and in your careers. And I'm really glad that you guys are sharing this, because I feel even more motivated to continue working in public health. I think, Angela, you mentioned that you're first in your family to come do some of the things that you've done. And along that line, there are many different communities who have family members who have served as the first in their family to achieve milestones for their family. And hearing those stories of challenges, successes, all of that can be beneficial for others who have served as firsts. I'd like to ask Daniela, can you share about your experience as being the first in your family to grow up in the US? And, how has that influenced you?
Thank you, Julie. Sure. Yes. So it was mentioned earlier, I think in my bio, that I was born and raised in Barranquilla, Colombia. I'm very proud of that. And I remember distinctly, it was my senior year of high school. I applied to this Rotary scholarship. I was waiting to hear. I got an email saying you've been accepted. You're going to be placed in Savannah, Georgia. I showed up to the US in August 2001. It was just me and my 2 suitcases. And there was a couple, a Rotarian couple, or my host family, with a little sign that had my name on it. So I literally knew nobody. I just got off a plane and there I was. This is my new life for the next year. Fast forward, I ended up staying through academic scholarships. I was able to get my bachelor's and my master's in public health. And then I was the first person in my family to do this. I'm the oldest of 3. So fast forward 8 and 10 years. I have a brother who's 8 years younger than me and a sister who's 10 years younger than me. They did the exact same thing. I think they saw that it was such a, I guess, successful experience or enriching experience for me that they decided to apply to the same scholarship. And I'm very happy to say that they are here and they have successful careers in investment management, my sister and my brother in financial planning and analysis. And so it's amazing though to have them here with me in the Atlanta area. I will say that when I reflect back on how that influenced me when I first came to the United States, I was a very shy and timid person. I tell people that and they don't believe me, but it's true. I was very, very shy. And being here by myself, forced coming to a new country, to a place where I didn't know the slang, the American slang, I had a thick accent. It really forced me to kind of find my voice and to push myself to become more assertive and more confident. And so I think that's how it's kind of shaped me into who I am.
That's really awesome. I know it can be very challenging to come here by yourself, and it seems like you were able to do that with much grace. And you definitely have confidence now. I can say that working with you, I see the confidence. Along those lines, speaking to trying to find our voice and to be confident and to continue to push ourselves to be our best, as a global health professional, how is it that you're able to navigate spaces where you might experience microaggressions from work partners or stakeholders in programs that you support? I'd like to pass this question over to Jonathan to share your experience.
So this one is also a very loaded question. And I just want to start off by saying that thankfully, up to now, I haven't experienced any microaggressions at TEPINET or the task force. So yay for that. But before that, I want to start off by saying that at least for my family, like being a Mexican American, my mom and my dad always implanted in our head, be thankful that you have a job. Be thankful that you can go to work every day and that you're inside of inside of a building, because my dad did construction. And so my mom has been a stay-at-home mom, but they always implanted that in our mind, right? And so being a college student and then going straight into the workforce and not pursuing like a further education after I got my bachelor's, I didn't understand like how to stand up for myself. And I didn't understand that sometimes there are certain things that you need to set boundaries with in terms of like the workplace and your personal life. And so I have experienced microaggressions, but I was ignorant to the fact that I was experiencing microaggressions because I was just thankful to be at my job and to have a job, right? But it was after I spoke about my situation. I'm not going to go into detail because I feel like we all can. I mean, I'm just going to say that I experienced vocal microaggressions, discriminatory verbal microaggressions. But at the moment, I didn't know because I thought it was part of the American workplace culture. You know, it wasn't until I explained what had happened to me to another coworker that they were like, that's not okay. Like, that's not okay here. That's not okay anywhere else. And after speaking to my family about it, my family, you know, they were just like, well, I'm sorry that you're going through that, but you need a job. You know, you need like a source of income. So what I'm trying to say is like sometimes even though our family is always there to support us and then they always like give us good advice, it's good to reach out. And in my instance, it's good to reach out to other communities. You know, communities that have, you know, had white collar jobs for longer than probably my family has. You know, because there are different work cultures, for example, in a construction site than there are like inside of an office. And then sometimes it does take like a deeper understanding of what these work cultures are. I mean, it's not okay. I'm not saying it's okay like in a construction site versus like inside of an office. It's still not okay. It should still be talked about. But what I'm trying to say is because my dad probably had never experienced something like that, he didn't know how to tell me how to maneuver around the situation or how to deal with it. And so being Hispanic, also, you know, I didn't understand that some of these terms can be like discriminatory. Um, and so when I talked to the person that was involved about it, this person was in HR. So of course they're not going to do anything because they're in HR. You know, what do they care? They're the ones handling these problems and they're not even doing their job. So I know that I should have like stuck my ground and like done something to change that place to probably promote a more secure environment for the next people that were coming in. But when I'm in those situations that I don't know how to manage something that is beyond my reach, what I like to do is grab my things, I'm not appreciated here, and leave. Because I can't, you know, there's only so much I can do. And my dad always taught me that I have to look after myself before I can help others. Now I feel like the only thing I can do is sit here and tell everyone else that if you ever experience microaggressions, even though to us as like Latinos, you know, we're very strong and we like to say, no, I'm gonna stick to it towards to the end, you know. Um, we all have our limits and it's not okay. It's not okay because once they do it to you, they're gonna start doing it to everybody else. And they may start off with a Latino and then tomorrow it may be someone from a different race. And that's not okay. And so, yeah, I was ignorant back then and I didn't know how to speak up, but I'm glad I have this chance now to, you know, tell everyone who's listening to, yes, speak up and do something about it because I've experienced it and I know someone probably else has, but they, you know, because we have that mindset, we might have not seen it as like, you know, that sort of situation.
Thank you so much for sharing, Jonathan. As we move into, you know, the areas of public health, as far as like taking action and next steps, I think what Jonathan was speaking to stand up for yourself, speaks to that. And so what I'd like to ask our panelists next is what areas should public health organizations who are interested in providing solutions to health disparities and inequalities experienced by Latinos and Hispanics in America, what should these organizations focus on? Daniela?
Thank you, Julie. So there's a lot to this question, I think. I think we can start with investment. Global health work in Latin America and the Caribbean is more limited as compared to the investments that we see in other regions of the world. So I do think that governments and philanthropic organizations are not investing enough in the region. The recent crises that we see at the US-Mexico border are an example of people living in poverty and desperation who are willing to sacrifice it all to come live the American dream. So if you think about folks in the Hispanics, Latinos in the United States, we make up about 18% of the US population. We are the largest racial ethnic minority in the United States and growing. There's been an explosion of Latinos and Hispanics in the United States. many of them living in poverty in the United States. So lots of issues related to the social determinants of health, factors like immigration, acculturation, they don't speak English, that affects the quality and access to healthcare, which is a tremendous public health issue. And so Latinos are also disproportionately affected by things like, we've mentioned it before, diabetes, obesity, high blood pressure. The mortality rates in COVID-19 have been a lot higher in the Hispanic Latino community. And so I would love to see an increase in federal program and research funding to help ameliorate the effects of the social and structural issues and barriers affecting Latino health. Mental health is another area that is, this anxiety, depression on the rise related to the difficult pandemic that we find ourselves in. And so that whole area, we're going back to Angela's point, we're going to need Spanish services in Spanish that are culturally appropriate to deal with taboo issues like depression, like anxiety. And we're just seeing an explosion of those issues, both for healthcare workers and for the general population. So that'll be, within the task force, I would love to see the task force programs expand our footprint and presence in Latin America and the Caribbean. And I would also love to see us recruit more people that look like the communities that we serve.
Yeah, I think you've raised some really good points, Daniela. Jonathan, is there anything that you'd like to add?
Sorry, yeah. I think it's important going forward to actually like implement just have like more of an understanding of why certain things aren't coming across, for example, from public health associations or public health programs to the Hispanic Latino community. And I think the main reason is because being part of the community, I know that sometimes we need to hear it from the right source. A lot of the times there are a lot of professionals that talk about these issues, but because of the lack of trust, the intent never crosses. So you could have someone sitting in a room full of Hispanic and Latinos, explaining to them, your community is at risk for getting diabetes. Your community is at risk for getting COVID because you don't listen to the suggestions that CDC is giving, and they will ignore everything because the right person or the right source is not giving them the information. Also, with this being said, there's like a lot of miscommunication in terms of like the community is very, very like involved amongst each other, and like we're a very tight-knit community. I will say that. For example, if someone goes to the doctor and the doctor tells them you need to take this medicine to take care of your inflammation, this individual will go to their house and call their aunt and their grandmother and their mother and get 3 different solutions to the same problem. And instead of taking the medicine, they will take the solutions that their relatives give them. And that is true. And so that's a problem. That is a huge problem because a lot of people also stop taking their medications that they were, given to solve these issues. And then that's a whole nother problem. So I feel like I agree with Daniela that a lot of these issues need like more involvement and a lot of like more funding too. But I think it's also important what Daniela said. We need representatives of the community who understand their community to do the representation. Because even if you have the funds and you have the objective to do these implementations of programs that will help the community, it will all be in vain. Trust me, if the right people are not, getting the message across. So yeah, I think that's. Oh, and also just one last thing. Also, I feel like news coverage could help spread these issues that are occurring with public health and the Latin American community, because I feel like a lot of the times you don't see these things. You really don't see a lot of the problems that are happening within the community on the media. You mostly see it like on more like news articles like on the web, and that's how I get most of my information. And it's not until I see those versus like seeing the news that I realize that there are certain things going on. Like for example, the situation with the camp here in Georgia, where there was like immigrants and they were getting mistreated, and you know, someone who worked at that facility had to say something in order for something to get done. You know, and a lot of people don't talk about it. It's just like they bring it up on the news once and then that's it. And then you don't hear like what's going on, you don't hear. And I feel like that's what needs to be done in order for more people to be aware of the situation, actually take action on it, because it just doesn't get covered enough, in my opinion.
Yeah, I think you both have raised very excellent points. I think oftentimes you can come to, let's say, the United States and be pretty siloed just in your community. And, you know, if you're just interacting with the people around you, you might be fearful of certain services or just question them and not, you know, have that trust there. And I think what you're speaking to having the resources available, having those, you know, trustworthy navigators who can help serve as representatives, and then just exposure within the news so that people outside of the community can also know what's going on, are very important. Because sometimes when you're in your specific community, you just assume everyone knows what's going on, and that might not be the case. So I'd also like to ask Angela, is there anything else that you'd like to add to this?
No, I think Daniela and Jonathan covered everything. I was just thinking in terms of how, as a global health organization, support, well, we're talking about supporting communities abroad, meaning in Latin American countries, versus supporting our Hispanic community or Latin community here in the US. And just one thing that came to mind was how we can empower those communities, especially those who are interested in pursuing a public health career. I have been having, I mean, we had hosted interns before, trying to empower the African community abroad. So they come here, they learn some skills, and then they hopefully apply the skills back in their home country. And I wonder if that's something that can be done with public health students or some type of internship that we could promote and run. We have tons of experts at that task force. Some of them are, you know, have a Hispanic Latin background. That could be a way for us to help the community, especially those who are interested in pursuing public health as a career. Just an idea. Sometimes we receive like inquiries from universities asking if we are willing to take a few interns. We can have some criteria. Maybe we can have just a minority type of program that empowers minority groups, either Hispanic, African Americans, and so on, to support them. I really don't like calling minorities, because I prefer for us to be called public health professionals with no labels in terms of race or ethnicity. When I came here, I never thought putting a label, because it's not the way that I see things. I understand there are racial issues here. I pretty much have seen inter-minority racism here more than other aspects that sometimes we talk Caucasians versus Hispanics and so on. I think that has not been my experience. What I have seen more is between minority groups that discrimination may exist, and that's something we have to pay attention to as well. But yeah, just thinking about potential solutions or ideas on how to promote, I don't know, maybe empower Hispanic groups or students or college students or anyone who's trying to pursue a global health, public health career through a mentorship program at a task force, or even individually, maybe on a case-by-case basis, like we have done at TEFINET, providing mentorship to some public health students who have an African background, or from different countries, or it's an informal way to do it, but we can try to sit down and think how to make this a formal way of supporting the Hispanic communities here or abroad as well. I agree with Daniela. We have to increase diversity in our workforce. We have to also help the communities abroad, but we can start at home. So I think that could be one way of addressing the problem.
I think you all have shared some wonderful next steps. And while it's not something that we can do in the short term, I think as we continue to work towards it, we can, continue to make an impactful difference within our community. We've heard a lot from the panelists and the discussion has been fantastic. I know I personally feel very galvanized and motivated from what we've heard and what our panelists have shared here. I'd like to share some of the Q&A from our chat. I see that we have several questions that the participants have shared with us. And while we'll do our very best to answer these questions, if we don't get to your question, please feel free to email askhr@taskforce.org, and we will try our best to answer all of your questions. So our first question here is for Daniela. With your leadership position at the Task Force for Global Health, what have you done to increase opportunities for your community, knowing that the Latin community is underrepresented in public health?
Thank you, Julie. All right, so I guess personally, every time we have a job opportunity that I know could be suitable to either somebody Latino or just somebody early in their career, I try to, in the past, I've done like the LinkedIn posting of the jobs, come work for us, we're an amazing organization. Also, I use my connections in the schools of public health in the area, mostly my alma mater, the Georgia State University School of Public Health, to try to get candidates to come apply for our jobs. I also serve informally as a mentor to folks. Like Angela mentioned, I like being a mentor. I like I feel like you get so much from those interactions. They're just so rich. I do think that the number of Latinos in public health in the United States is a small group. I'll tell you anecdotally, I just don't have that many Latino colleagues. I'm hoping that with the pandemic, that's starting to change. I hear that there's a record number of folks, high schoolers applying to undergraduate degrees in public health, and record numbers of folks trying to get masters in public health. So I'm hoping that's going to change, but it's a tough one. I don't have the numbers, but I know anecdotally we're a small, we're not 18% of the public health workforce, but we are 18% of the U.S. population. So I would say, I also will think that these types of panels and opportunities help, because honestly, in my humble opinion, public health is a dream career. I hear a lot of people dissatisfied with the careers that they've picked. I've always been happy and satisfied with mine. So hopefully as people hear us talk about our careers in public health, they get inspired and more Latinos decide to pursue careers in public health.
Thank you, Daniela. Thank you for all that you're doing in regards to bringing more awareness about public health and sharing that with different potential colleagues. Jonathan, do you have any advice to maybe young folks in the Latin community who want to get started in public health?
Yes, don't give up, because because the main thing I want to bring up is persistence pays off. I'm applied to 26 jobs at Emory University before I got the yes from TEFINET, which means that Emory and TEFINET itself, they're very hard to get into. It's not, it's not a joke. So never give up. And also look at the different fields within public health, because just because we say public health, that does not include just, you know, one area. There's public health areas that center around different topics. So I would say the first thing is to do your research. Make sure that you know what field within public health you want to get into. Because, for example, when I was applying to jobs, I saw one that was revolving around AIDS and AIDS within the minority population. And I thought, you know, that was really an interesting topic, you know. But then I saw TechNet and the task force, and then I told myself, there's people abroad, like on a global scale, that also need the help, because I feel like here in the United States, we do have help. A lot of the times people may just be scared to reach out, or they may not have the information. But when I saw TechNet, I was just like, I saw the position, it said, we need a Spanish program assistant, a Spanish speaking program assistant. I was just like, oh my God, yes, like this is totally written for me. Like, cause you know, after getting denied from like the other 26 positions that I applied to, I was just like, okay, they possibly can't turn me down from this one. I was like, come on, like I speak Spanish fluently and I know how to write it, and I have a bachelor's degree in it. I was like, please, you know, and so it paid off. You know, I did my research on TechNet before I interviewed. Oh, that's another thing that I can give you advice on. Before you go to an interview with any company, make sure you do your research, because they will ask you, why do you want to be here? Why did you choose us? Why did you agree to this interview? They will even ask you, like, why did you agree to the interview? You know, I know a lot of the times, a lot of us apply to like 50 jobs, and then when we hear from it, we're like, I don't know where you're reaching out to me from. You know, I applied to like 50 jobs. I have no idea. But always make sure you do your research, because it's important. And so I guess my advice to you is persistence. Do your research, and also understand that you're not just getting into this to just have a job. You're getting into this to help a group, for an individual. So always have that in mind. Like, no matter what you do in the field, you're doing it to help someone or something. So I think that's important.
Thank you so much. And I really appreciate your enthusiasm, because after applying to so many positions, it can be a little disheartening, but I think your persistence really shone through. So I'll do one more question. And I think maybe, Angela, you've already kind of touched on this, but if you could just reiterate a little bit by giving us a few points. How can we be good allies to the Hispanic Latinx community as workers in public health?
Mhm. Yeah, I think I mentioned that previously, in terms of how, yes, we could do things individually, obviously, outside of our organization. We can do that as a whole, as a task force. And I think the way I see, if I have to do it independently, will be through informal mentorship, as Daniela mentioned. I think we all do something when a public health student approaches us and tries to learn more about our careers and some tips and some advice for the future. That could happen, or we can do that formally, as I mentioned, through a internship program that focuses on minority populations, and we try to put that as a criteria to help them out and see if their time at a task force and kind of will help them to be more prepared, at least more knowledgeable and understanding that public health is not an ego boost career, it's a purpose career. I have learned that it's quite different. So you have to have the right mindset and like the right intention, I think, if you want to go into public health. But that would be a way, making sure that everybody who would like to do that, obviously, that has the passion for mentorship, could put aside some hours of their time every month or something to speak and guide an intern or a fellow. That could be a possibility.
Fantastic. Daniela, would you mind sharing a little bit more onto what Jonathan said about advice for younger people within the Latin community who want to get started in public health?
Yeah, so I really love, Jonathan, what you said about not giving up. I mean, that's impressive that you submitted, what, 26 applications. That's incredible. I have it's not that kind of story, but I have a little kind of don't give up story. So when I was getting my master's in public health, I took a class in global health, and we had a bunch of guest speakers. And one of our guest speakers was Dr. Mark Rosenberg. He was the previous president and CEO here at the task force. And he gave a whole full lecture on the task force and our work. And this is back in 2006. So the organization was a lot smaller, looked a lot differently. And he spoke about a program on road safety. And I'm sitting there thinking, I want to work there. I want to work there. I mean, I'm almost at the end of my MPH. I needed to find a job. And sure enough, I graduated and I reached out to HR. And at the time, it was a small organization, maybe 60 or less employees. And I was told, no, there's no opening here. So I was like, okay, I found myself another job. And then fast forward 3 years later, like you, Jonathan, I saw a job description for TEFINET and I read it. And I was like, I can do every single thing on here. This just looks like exactly what I need to do. So, you know, I applied and here I am 11 years later. So, so yes, 100% to don't give up, and things will work out, but you have to be resilient and persistent.
Fantastic. So what we're hearing is that the Latinx Hispanic community does not give up, right? No, we are persistent if nothing else, right? So thank you guys for sharing so much of your personal journey. I hope it has helped everyone to kind of get a feel for what our experiences have been like in public health. To that end, I'd like to go through maybe some final thoughts. And, you know, you can take the question in parts or in whole. And what I'm asking now is, you know, what advice would you give other Hispanic Latinx professionals who want to pursue a similar career path? What is one piece of practical advice you would give to someone starting out? So you've each touched on this. So just share a little bit more about what pursuing this career path looks like and what's needed. Daniela.
Okay, I'll start. Okay, so what I would say would be, don't be afraid to take the entry-level job. You got to start somewhere. Take the entry-level job, roll up your sleeves, get right to work, collaborate, be a good team player, have good, strong work ethic, help others shine. And I guarantee you someone will notice and you will be seeing doors open and new opportunities. I would also say, because and I think especially because we're talking about Latinos pursuing a career in public health, culturally, it's usually not okay to say my plate's full. I'm overwhelmed. Especially you don't say that to your boss. You know, they bring the work and you say, okay, all right, I'll keep going. So I would just say, be assertive, you know, find creative ways to, I mean, the work needs to get done. Let's find a way to get it done, but learn how to say no and you know, in an appropriate professional manner. And I also would say, and this is something I'm still learning how to do, just take time off, unplug, take the days off so that you can come back ready to get back to work.
Absolutely. Absolutely. That's important. You know, if you're not taking care of yourself, it makes it even more difficult to take care of others. I think I'd have to say what I love really about Hispanic Latinx community is, you know, the community itself. It seems like you always have some support there, you know, if it's your siblings, your parents, your own kids, very tight-knit culture. And sometimes you can maybe get a little unsettled if you're in an environment where you don't have that same support. So this resilience is very important. I'd like Angela to give you the same question, give you an opportunity to respond.
Thank you, Julie. I was thinking maybe be resilient and come to TEFINET, because it seems TEFINET has hired most of the panel here today. So that would be my advice. But I think, yeah, just have the right mindset. Build character. Character is important, and confidence to do this job. You will encounter a lot of challenges along the way. Who doesn't? But that's why resilience is important. And just always set up a goal for yourself. We always have to have something to strive for, and it's for everybody. And again, I will repeat, just come to TEFINET. TEFINET seems to be the place for Hispanics to come and work in public health. And I appreciate the fact that TEFINET, cares for diversity. So that's a good job.
Jonathan, we'd like to hear from you. Your thoughts?
Yeah, I think Daniela and Angela did a really good job at saying the main things, but I think if any final things, I just want to reiterate, don't work for free. I know like public health is a field that you're supposed to do like out of the kindness of your heart. It's not supposed to be, but we hope that you join public health because you want to change the community, but don't ever work for free, because once you let people like step a foot in your office when you're not supposed to be there anymore, they will continue to give you work. I'm not saying this has happened to me in TEFINET, but not yet, and hopefully it never happens. But it has happened to me in the past, and because like what Daniela said, we're expected to just be like, yeah, I'll do it. But it's also that's like such a toxic environment, and it can tire you out really quickly. And so something else I wanted to say was, have self-respect and have dignity. If you know that you're like getting taken advantage of, don't be afraid to speak up, because most of the times that things don't change is because nobody says anything. Don't think that just because you're, for example, I'm a program assistant, right? Don't think that just because you're a program assistant and you have a manager and a coordinator on top of you, you can't say anything. You should be able to say something. It's your workplace. You're at your workplace more than you probably are at home, interacting with other individuals. So I would hope that you feel comfortable enough to say something if you feel uncomfortable. And then also volunteer in the field that you want to take a part in. For example, I volunteered with my sister when she was doing her trainings, because they didn't have enough people in that program that she was working at the time to actually conduct the training sessions. And so I volunteered to do it because I was like, yeah, like these are Hispanic men, Latino Hispanic men. Of course, I was like, why not get myself involved, change something for once. And so I got involved. I didn't get paid. I did it because it was out of the kindness of my heart, and I wanted to see what my sister did for a living. And so I did it, and it actually helped me understand why she did it and why so many other people are going towards public health. Because Shalonda, who works in TEFINET, told me that there are two aspects of public health. Thank you, Shalonda. So I'm just gonna quote you. Shalonda said that there's like the administrative side, and then there's like the field work side, right? And so me like being in the field with my sister, it basically got me to understand, okay, this would be how field work is. And then now working for TEFINET, I work on the administrative side. And now, I understand, okay, well, maybe if the administrative is like a little tiring for me in terms of like sitting at a chair all day, maybe field work is something I like to do. I'm not saying that's the case, but I'm saying like it will help you understand what it is that you want to do. Just volunteering. And then have a mentor. I think Angela brought this up. A lot of the times, there aren't a lot of Latinos in the public health realm, but I feel like it is always important to have a mentor. As a matter of fact, I had a mentor who worked at my university who had nothing to do with what I wanted to do. He worked at the gym, but he did administrative stuff in the gym. So just being involved with someone that knows more individuals will get you much further than just you being alone. And you don't feel as alone as you would if you didn't have a mentor. You never know who A, B, and C might know in that realm that you want to, that you aspire to be in. And I will say that in today's world, you need that. You need that communication, because that's how the world moves nowadays. It's not like it used to be where people just looked at your resume and they were like, "Oh, you went to Emory, that's awesome. That means you're very smart." It's not, that's just not how it works. People could have 3 different resumes. One of those resumes was recommended by someone that person knows. And even though you may be from Harvard, Yale, I don't know, you may be from somewhere really high up, guess what? The person who was recommended to them was the person that was chosen, all because of communication. So I will say that it does matter who you know. So get yourself out there, meet people, and put your name out there so that people know who you are. So yeah, so that would be the advice.
Excellent points. And I think speaking to what you said about, networking, reach out to and create, different networking opportunities, LinkedIn, look at the organizations that are doing the things that you want to do and reach out to the people there and create your network that way. And just looking at the different skills that are needed and do your best to augment yourself in those areas. Man, very fruitful discussion. Thank you guys so much for sharing. Like, this has been fantastic. So, just getting towards closing us out, the Faces of Global Health is hosted by the Council for Opportunity, Diversity, and Equity, known as CODE. And on behalf of CODE, I would like to thank everyone, thank our panelists, thank you for everyone who's participated today, and just, taking part and joining in this discussion. If you have any follow-up questions, or if we did not get to your question, please submit them to askhr@taskforce.org. And if you want to learn more about the Task Force for Global Health and the opportunities that we have, or if you want us to just share the recording of today's session, visit taskforce.org. And everyone, have a great afternoon.